everybody, welcome back. Today I want to talk about a subject that patients that come and see us, especially the ones that find us online, they sometimes will call, or we'll do a virtual with them and to figure out what their needs are, and sometimes they'll mention they think they have gum disease, or that their dentist said they might have gum disease, and
oh my God, my gums! They hurt so much!
And then lo and behold, when they come in, they actually don't have gum disease, they actually have gum recession. And I think there's a bit of confusion, amongst the, just the general public about what the difference is between gum disease and gum recession. And it's it's a very simple distinction, but it's easy to get confused. The first thing is that gum disease is due in part to bacteria that accumulates around the gum line, and plaque or calculus or tartar that causes inflammation, an inflammatory response from your body, your immune system that kicks in and basically causes destruction of the gums around the teeth and then eventually the bone. With gum recession, a lot of times that's due to, in most cases I've seen, due to aggressive toothbrushing. There are some cases where the bite itself, somebody that's a heavy grinder or clencher can contribute to gum recession, but by and large I see most of the cases are due to heavy-handed toothbrushing, and which is easy to correct in some people and a little tougher to correct in others. And I have patients that'll ask me about, well, if I have gum recession, do I need to switch my toothbrush or anything like that? Should I get an electric toothbrush? And I always tell them that it really doesn't matter what kind of toothbrush you have. It's really, the most important thing is that you're using the brush appropriately, and that has to do with your technique, how you posture the brush, how you move the brush. And with a manual brush, is basically you want to make sure that by and large you're not putting too much force on the brush, putting too much pressure on it by grabbing it with palm fist type of grip, and brushing motions that I say are like saw-like motions. And so I always tell patients that the best way to go about doing it is, if you're going to use a manual brush, which is totally fine. Most brushes nowadays, unlike the brushes of back in the days of the hard bristle toothbrushes, most brushes nowadays are pretty soft to medium bristles. And so it really comes down to just not over gripping the brush, using more of a finger grasp, like kind of like you're holding silverware, and also just keeping your motions more in a circular motion, or up and down motion's fine, just don't saw. And that usually hits home with people when I say don't saw, and that way when they go home they can pay more attention to how they're brushing in the morning or at night, because usually in the morning you're getting up, you're going to work, and you only have so much time to get ready, and so brushing is like, it's the last thing I do before I go to work. And so the tendency would be to overdo it at that point, brush a little faster, and not taking the 2 to 3 minutes that's recommended to brushing, and that's where most of the damage can be done. So I always say, pay close attention to how you're brushing in the morning, especially, and make those adjustments, and I think you'll see a difference as far as the condition of your gums. And as far as electric brushes are concerned, if you are going to use an electric brush, it's completely fine. Most of the brushes nowadays, they have pressure sensors. They light up or make noises if you're pushing too hard, and that's fine. But one thing that does not account for is the motion. So if you're using those electric brushes in a vigorous motion like you do a regular brush, you can cause way more damage to the gums that way. And so you just have to make sure, what I tell patients is just let the brush do the work. You know, turn it on, kind of bounce, you know, a little bit, you know, kind of work one area to the next, and just take your time. And if you don't have the time to do it, especially in the morning, then just use a manual brush. And in the evening, when you do have time, then use the electric brush. And you can use both brushes. But I found that that's one of the best things you can do to prevent further gum recession.